the steps or the flow of the alert process. And we have designed a five systematic process to guide our effective alert management from initial detection to ongoing monitoring and to documentation. So the first thing is alert detection. The system automatically identifies potential alerts through the surveillance data analysis or picking up reports from different field sources that have been entered on SORMAS, including the laboratory sources of information. The system picks this up, triangulates it, and notifies the system and the public health system of an alert or an event that is likely to be an outbreak. Once that happens, the system is prompting us for an action, right? And once the system prompts such an alert, we're expected to verify, which is the next step. We're expected to verify such an alert. And when we say verify, we want to confirm the accuracy of what the system has placed as flagged. We want to also see if the reported information that we have is true, is validated through our data. For example, if SORMAS picks an alert now and that there's a social outbreak in this particular place because there's a positive case of Lassa fever, the state's structure is supposed to verify such an alert that yes, we have a report of this case, and with the lab result also confirms that this is an outbreak, right? And then they trigger the next steps, which is risk assessment. They try to conduct a risk assessment, evaluate the public health significance of this alert, of this event or an outbreak, then look at the transmission potential, look at required response level, and they do all of this risk assessment to assess what is the level of risk of this outbreak or this alert that has come out, so that it can prompt them to respond and activate response. So the next step is to activate their response. They deploy appropriate response measures, including case investigation, contact tracing, and control interventions, so that it's not just that the system is speaking alert and we're letting it lie fallow. No, we are responding, we are assessing the risks of that outbreak alert, and we are also responding to such, so that there will not be outbreaks happening in our local government, in our facilities, in our communities, without a corresponding action that will be taken. So it's going to be a system where, as the system is speaking the alert, the surveillance system is ready to conduct the next step of verification, the next step of risk assessment, and the next step of response activation at all levels. And the last thing is to document and monitor that event. We want to also maintain a record of the alerts that has been responded to, the alerts that are still pending, the alerts that has been completed and closed, the outbreak that has been completed and closed. We want to take that progression and understand and document such a report, so that if the national, for example, asks the state to give a report on the outbreaks they've had in a year, they can also, through this documentation and monitoring, provide such an information. So it's very key that we follow this critical steps that will help us manage our outbreak alert and support the work we do as a public health system. Next slide. So managing alerts on SORMAS, we in the next 3 minutes, I'm going to demonstrate how our surveillance optimized SORMAS manages alerts, and I would just show us around within 2-3 minutes, and we can always engage and afterwards. So the first thing to access SORMAS, we know, is to log into the platform through the URL, which we call the website link. And once you click on it, you will see a page. So we see a page that shows the username and password, and we enter that username and password. Once we access that, we enter into SORMAS. And once we enter into SORMAS, we'll navigate to where we have the Outbreak module. And when we see the Outbreak mode, when we click on it, we'll see the directory that shows the different alerts that the system has picked up, and the ones that is corresponding to our state or LGA will respond to it, verify it, and follow the process in the previous slide that I've mentioned. So there will be a responsible officer at all levels that will be able to monitor this outbreak alert that is coming on SORMAS, so that will be communicated in due time. So the dashboard provides filters to prioritize alerts by urgency, location, and disease type for efficient workflow management. It also has the status of the start of the outbreak, the start end, especially when the confirmation and verification has been done. I'll show us that in the next slide. Next slide, please. So just to tell us some critical information that we need to understand when we are verifying alerts. As I mentioned earlier, verification ensures alert accuracy before initiating resource-intensive response activities. So we have to confirm and verify every alert that SORMAS brings out before we respond, so that we'll be sure that what SORMAS is speaking is the same thing that is happening in our local environment and communities and LGA. And to confirm information accuracy, you want to review all reported details, including the date, the location, the case count, the symptoms, to ensure completeness and consistency with the source data, which is our paper CIF, and also what is on SORMAS, to confirm that that information is correct. You also want to work on contact reporting sources. You want to look at the reporting facility that has reported that case. You want to check in with them. You want to check in with the surveillance officer. You want to validate the initial observations and gather additional context or clarifying information about this particular case that is being picked, or the outbreak that is being picked. Then you want to check case definition. Did they check the case definition actually aligned with the standard case definition and all of that? Then you want to validate the laboratory results, the result that has come out as positive. You want to do some background check and from the lab, and to ensure that this is a correct laboratory entry that has been entered on SORMAS before the next action. Next slide. So to just talk briefly about the best practices for alert management, the first thing, which is very key, is timely verification. We must complete initial verification must be done within 24 hours of alert receipt. So any responsible officer that has been assigned the duty of verifying alerts, that outbreak alerts that SORMAS picks up, must do so within 24 hours, because we want to prevent delays. We want, in outbreak response, we want to minimize transmission risk. So we're from now henceforth, as SORMAS pops up this outbreak alert, we are expected that the responsible officer act promptly within 24 hours to verify the information and start the next steps of the process. And also accurate documentation. You must the officer and also the team should maintain detailed record of the verification activity they've done, the communication, the decision support, and all other information. Then team coordination. They should coordinate closely as a surveillance team, especially with the laboratory, the response unit, to ensure consistent information sharing and aligned action. So it's not just that SORMAS is popping outbreak and they are verifying and let it go. No, there should be coordination that sync with the system as they are verifying the alert, as they are doing the risk assessment, as they are forming the response team and action. This should be in a coordinated way, especially from the states, the LGA, and also national. So, and you support rapid response. There should be a support immediate investigation and response activity. I'm sure all the LGAs and state level, even to the national, we have a rapid response team that has been trained over time. So we should deploy rapid deployment of this team to ensure appropriate public health measures. So this should be in a coordinated way, where also timely and accurate documentation. Next slide. All right. In conclusion, effective alert management in SORMAS strengthens early detection capabilities, improves outbreak response, and support data-driven public health decision making. That's the goal of this alert management on SORMAS. We want to strengthen early detection, we want to improve our outbreak response, and we want to support data-driven decision making. And we need to follow systematic verification and response protocol. Surveillance officers can transform raw signals into actionable intelligence that protect the population health and prevent disease transmission. That's the goal. So we want to transform this thing not just from alert signal or from signals, but we want to transform it into actionable intelligence that can help protect the population health. And to conclude, timely alert management is the cornerstone of effective outbreak response and public health protection. So as we see it, this is a very useful tool for the surveillance system in Nigeria. It's important that we make use of this part of SORMAS, which is the outbreak module, to be able to pick alert and respond timely. So I will be going to demonstrate the on SORMAS how this particular thing works. So I'll be sharing my screen in a bit. Just give me a second. Just a second. Okay, please confirm if you can see my screen.
Yes.
Okay, so this is the live SORMAS. So I'll just quickly move it into the staging SORMAS. Like we mentioned yesterday in the training yesterday, we must be careful. There's a difference between the live SORMAS and the staging SORMAS, as we could see on the screen. The staging SORMAS starts with staging the SORMAS, while the last SORMAS just starts with SORMAS. So we must be careful so that we don't report live data on the staging instance. So we are here, we put our username and password, and we log in. Okay, so once you log in, you have different modules as we've taken us through that yesterday. So where are we going? If you want to look at the outbreak alert that SORMAS has picked up, we look at outbreak module. Look at it here. This, I think, third to the last. So you just click on it. And once you click on it, it would look at, let me just take this off so we can see the screen very well. So it will bring us straight to the outbreak directory that shows the alerts, outbreak alert that has been flagged by SORMAS. So if you remember yesterday, while I was doing the demo at the end of the session yesterday, I created a case on SORMAS, Lassa fever case, and I updated the results to be positive. Immediately I did that, SORMAS flagged it here as an alert for an investigation. And we all know that a single confirmed case of Lassa fever is an outbreak anywhere in Nigeria. Yes, we are still debating those endemic states if that still holds, but for every other state in Nigeria, every confirmed case is an outbreak for Lassa fever, right? And so the system has triggered this as an alert. So anybody that comes here would see this alert, especially for Osun State. If Osun State opens their own SORMAS platform, let's assume this is the live platform. Yes, this is staging, but on the live platform, once they open the outbreak, they will see this alert and they will be able to click on this button. The officer saddled with responsibility of verifying alert will come here, click on this button, and it would bring this information for the person. It's expected that once the person sees this information, the person should be able to verify the outbreak. And if the outbreak is confirmed to be true, that this particular case has this positive result from the lab and is confirmed, the person comes here and update the outbreak status to be confirmed. But if the person checked and say, no, it's the laboratory, after verification and question and investigation, the lab says, that entry was a mistake, it was for another case, or blah blah blah, or something else happened, the person can now say it is not true. Then the person rejects the alert that it is not an outbreak, right? Or if it is truly an outbreak and is confirmed, the person confirmed and puts the start date of the confirmation of when the outbreak starts and put it in, right? Then says done. Then at the end of the outbreak, maybe after few months of response and everything, and the outbreak is over, the person can come back here and come to outbreak status and click ended. That means the outbreak has ended, right? And the person puts the end date of the outbreak here, right? Let's say it ends in 25th of March. The person posts the date there that the outbreak ends. You can see that I cannot click for future dates because, of course, it's not SORMAS is structured that way. You can't put a date in the future. It must be a current date, right? So let's assume today is 27th of March. Now I'll be able to click on the day it ended. So that's what this officer in charge of outbreak alert verification and management will be able to do. So if you click this now, then I click on done. Once I do that, you will see that this directory will change. The start date I've put there will reflect, and the user that updated the status will show, right? So we can be able to track and use this. So that's that about outbreak alert. So I would stop sharing from here, and we can entertain questions and prepare for the next session. Thank you for listening. Over to you, Vivian.
Yes, thank you so much, Stephen, for the very detailed and wonderful presentation. Thank you also for taking us through the demo session. And I think colleagues will all agree with me that the whole purpose of SORMAS is for real-time reporting, which should trigger prompt response across all levels. So this just shows the significance of the optimized version of SORMAS. Okay, so I see a hand raised. Mr. Zezes Bolus, please go ahead. So if you're speaking, we can't hear you.
Okay, good morning.
Morning.
Yes, yesterday some of us joined due to network. We joined while the first session was already done. So is it just normal entry that will bring about the outbreak, or how is it entered there? We only see the modification today as to whether confirmation of the outbreak but we didn't see how was it from the initial. I don't know if I'm the only one that missed out. Thank you.
All right, thank you, sir. Noted. Any other question? We're taking just two, then Stephen can respond and then we'll move on. Okay, so Stephen, go ahead there. I can see one other hand raised. Let me quickly check. Okay, Fatai Sahid, please go ahead.
Yeah, thank you very much, and thanks for the presentation. So my question is this: so when there is a confirmed case and we are updating the alert, so I just want to ask, who is in charge of doing this in the state? That is to update on SORMAS when it comes to this. Thank you.
Okay, thank you. So we'll give room for Stephen to respond. Please, any other question, kindly use the chat box. Thank you. Over to you, Stephen.
All right, thank you so much for the first question, the person that asked the first question. Like we demonstrated yesterday, so once you're doing your normal data entry on SORMAS, you have a suspected case, you have this case investigation form meaning you have investigated the case, you have the CIF, and you are entering on SORMAS. We reiterated yesterday for timely reporting. So within 1 hour of your investigation, you're expected to enter the case on SORMAS, which is the new standard that we want to follow. And so once you enter that suspected case on SORMAS, you're expected to, as part of the information you're filling on SORMAS, you're expected to fill in the sample collection part of the details, right? So once you fill the sample that you have collected, the lab you are sending it to, the date of sample collection, the type of test you are requesting, once you do all of that on SORMAS, it's expected that once the result comes out, it is expected that the laboratory that conducts the test updates the result on SORMAS. And once the result is entered on SORMAS, then if it is confirmed, right, if the result is positive, then SORMAS flags it automatically as the result is being entered for diseases that one confirmed case is an outbreak, right? So for other diseases, for example, like measles, that it is until they have 3 confirmed cases in a region before the system flags it as an outbreak. The system also takes that into cognizance and waits for the confirmed case to be up to 3 before it flags it as an outbreak. Are we together? Then so that's how it is disease specific, depending on the threshold that each disease has. That's how the outbreak alert comes. But this first step is entering of the suspected case on SORMAS, filling all variables completely, including the sample, the epidemiological information, the clinical history, the symptoms information. Then the next thing is for the result to be out, and if the result turns out to be positive, then depending on the threshold of the disease, SORMAS picks it as an outbreak alert. I hope I've been able to answer a question. So for the second question on who is responsible for verifying alerts at the state level. So currently that discussion is ongoing between the national and the states, but we want to that responsibility to be with the state team, right? Because it's not just clicking SORMAS and entering the status. It's also about someone that is involved in investigation at the state level or at the LGA level. So the state team is supposed, normally it should be the state DSNO that does investigation, right, at the state level. At the LGA level, the LGA DSNO does investigation at that level, right? So, but that discussion is still ongoing to see if our state DSNOs can take up that responsibility to be able to do the investigation of this alert and also go to SORMAS and update. But of course, if there's this lag in timeliness between how the state DSNOs are handling this role, we can ask the SLOs to support in prompting them to be able to do this. But we want the state to take ownership of this so that they can declare their outbreaks themselves, and it can be a state ownership thing. So the SLOs just support them to fast track the process. I hope I've answered this question. Thank you, and over.
Okay, thank you, Stephen. I hope the concerns of the participants have been addressed. So we'll just move over to the next session, which is the tax module, which will be taken by Mr. Shegun. Mr. Shegun, please, over to you.
Good morning, colleagues, and good morning, everyone. I'll be taking tax module on SORMAS, optimized SORMAS. Next, please. Next slide. Yeah, what is task modules? Task module is SORMAS, and SORMAS is a module that manages assignment and tracking while ensuring accountability in surveillance system. So this module is used to track assignment within the system. So all what we're doing there is all about sending a message in a form of assignment, and then to the end user, over to the receiving end. So in other words, so as a state state level user, level users on SORMAS, you have that very particular permission to actually assign assignments or carry out other activities within the modules electronically on this very particular platform. Next. So importance of task module is to improve the timeliness of investigation, enhance supervision and accountability, and improves response time in SORMAS. So all these can be carried out on the task module. Timeliness of investigation of whatever is going on due to the distance, or maybe what you cannot reach out, and the information is urgent that you need to get response on that very particular event. So next, please. So what are the key features in optimized SORMAS tax modus? One, what we do here is manual tax creation. So we know in some of the platforms, like for instance, the platform that can automatically generate a tax. But when it comes to SORMAS, what we do here is we create tax manually, and the tax are based on on rule. You understand? So in other words, the state AP can actually ask the state DSA, no, oh, please do this for me. And the state DSA can also add ADA to say, okay, do this for me. So this is what we mean by rule-based tax assignment. And when you look at this very arrow here, you see that we have a tax status tracking. That means what is the condition of this very particular assignment in which give it to someone. So is it pending, in progress, done, remove, or not execute? So these are the key features that are on the tax module. Next. So what are the modules that are integrated with optimized SORMAS? One, you see here we have a task contest. This simply means out which environment are you actually creating this very particular task. So if you can see under this task contest, we have case, contact, and we have events, we have a travel entry, and we have a environment. Now, when you look at this very particular page, you see that in this very particular lines, we have a general module, which is active. This means that this very particular platform alone is this very particular page. You can only create a general task within this very particular page. So every other pages are every other taxes are emanated from the relevant pages. So please, next. Now, tax money benefit to public health system, improve response time, better monitoring of field officers, data-driven supervision, strong outbreak control. So response time is one of the benefits of this very particular modules, because you can actually carry out an activities within your environment and your subordinates are not actually aware. And this thing, if you send this thing, you can actually call the person. Well, so it has to be in a two-way support, because one, if you carry out assignment on this very particular platform, it did not inform the person that you are sending task to, maybe verbally. So the person might not get to the system in time. So it's good whenever you assign this very particular task to anybody, if you can also follow up with a call. Please, there is something on your on the SORMAS based on task. Please kindly verify and get the feedbacks in time. So this keep track of records. So it helps keeping improving time, also keeps records. So, and again, it's better monitoring of field officers. So what are you doing? Have you done what I asked you to do? So all these things happen and also data-driven supervision. So we're able to supervise what is actually going on with your subordinate or the person that you assign the task to. Then again, a strong outbreak control. So a lot of communication can actually happen within this very particular platform that will help us to be able to manage a outbreak. And this is a very good platform that we can actually manage so many things in terms of communication within the systems or user. Next. So conclusion, task module strengthening accountability, ensure timely outbreak response, critical tools for effective disease surveillance. So next. So what are the steps to get access to this very particular task modules? One, just as all those people that presented before me said, you need to log into the platform first. So first thing is to log into SORMAS. And by the left hand, you see all the list of menu. I think you can see task is number 3 up there by the left. When you click on the task, look at your, what's it called? The top right, you see words, a new word, create new task. At the clicking of this very particular new task, a form we actually came up and come up, and then you proceed filling all those forms. And when you look at it, just as I mentioned, task context, this is to inform user on task type. On task type, is this case? Is this task creating from cases, contact, events, or travel entry from from environment? So this is the kind. This is what you see under task context. Where is it actually coming from? Then when you look at it now, just as I said earlier, the general is activated by default. Other tasks are created from relevant pages. Now, if you create tasks from case, it will only you see that task attached to that very particular case. And when you create from contact, you see the task attached to that's why you see in this very particular task context is only general that is active. When you create case from, if you create task from a case, the case column will be active. And when you create from contact, the case the contact column will be active. So I think we can see the last end here. It's in gray color, so it shows that this is the kind of task you are trying to create. Then you now proceed in filling the form, and then you click done after you have completed filling all the variables as required. Next, please. So task module demo. So we are going to be using staging to do the demo. I don't know, before we proceed to the demo, is there any question that we can actually dwell on before we proceed? Thank you, Vivian.
Thank you, Mr. Shegun. Maybe you should just proceed with the demo, and then afterwards we can take questions.
Okay. So I can share my screen, right?
Yes, please go ahead.
So I will all see my screen, right?
Yes, I can.
Okay. So just as we said earlier, you need to log in, have your username and password before you can access this very particular mode. Then I click on log in. So on the login, as you can see, we have a plain page here. So coming to the left, you see the task menu. Then you click on it. So these are the tasks that have been carried out in the past. This is the line listing of all tasks that has been carried out before now. So if you are creating your own now, you need to go to the right corner, and you see new task. You click on new task, it will give you a page. Just as I said in my presentation, you see the last end here, you can see it's gray because of you are in a general task environment. So in this place, You can discuss any other thing that does not what attach to either case or contact, or even though you can still also discuss something that has to do with case and contact. But note that this very particular environment, this platform under general does not attach to any case, contact, event, travel entry, or what environment. So you now proceed in filling what the form. So task type. So other tasks as described in the comment. So this means that when you click on this one, you have to what? Click on the word suggest start date, which is today, and go by due date when you want this task to end. Let's say 9. Then assign to who. So in this very particular place, we have names. So I am my user there is national user. So I have access to all the users across what the country. But one thing I will enjoying us here is that let's make sure that we know the user and credential of the person that we are assigning tasks to, because you might be seeing so many names here, and then so you not assign a task to the wrong person. So let's take note of that and get familiar to the person's user. So I'll be assigning tasks to test 1. Then what's the priority of this very particular? Is it emergency? Is it normal, not in hurry? Is it what? Is it something that's not what too serious? So if it is high, which is very, very what, we need it urgent, and you click high. Then if it is what normal thing that you don't need to press the person so much, you click normal. And if it is low, at any time you can just deliver. So you click what on low. But I suggest that whatever we are doing, we should take it serious. This is not a social media platform, but this is where we whatever we do here, it has to be official regarding what SORMAS. Yes. So now you put your word comments here. What do you want this person to do? You put it there in form of writing. No, for instance, check the case. Okay, this is under general. Check the case person for me. Okay, check the case person. So when you put it here, to actually tell the person what you want the person to do, and the execution comment. This thing after the person has carry out the task, what should be the person the person should be able to to comment, okay, yeah, this thing is done. So at your end, for you not to keep track of things, okay, if this is done, you click done. If it's still pending, you click pending. Then if it's not executable, then you click. So all these things, they are task statements that we need to actually also make use of. So although if you don't make use of all these bars, that means you can't even proceed to say, okay, this thing is done or not. So who is observing the task? Is it you, or you are assigning to the third person? So we need to also know who is also observing this very particular task. So after you have filled up this thing, you click you click done, and the task is created. I don't know. Okay, okay, pending. Let me click on pending. So, and the task is created. Though, as you can see, the line list here, we have a task. So let me just pick one that is attached to case. Let's open before I now open the one I created just now. Now, if you see now, this one is attached to case. When you look at this contest, you discover that the case is the one that is that is active. And when you look at the one that is also attached to to contact, you will discover that the contact will also be active. So concerning the event, travel, and entry and environment module, we are still working on it to get that one all to be active. So let's look at the one I just created now, and discover that it's going to say general. So that means this tax is not attached to any of this case, contact, and so on. So this is what we have on task creation. Thank you.
Thank you
Over
so
to you,
much.
Vivian.
Yeah, thank you so much, Mr. Shegun. I think tax manager is something where most of us are all familiar with. But are there questions for this session? I don't see any hand raised. I also do not see, okay, no, these are about attendance. I also do not see any questions in the chat box. Colleagues, please, the registration link has been shared. Kindly register your presence using the link. Are there more questions, or do we move ahead to the next agenda, to the next item on the agenda? Okay, so the absence of...
Stop sharing your screen.
Yeah, Mr. Shagu, please stop sharing your screen. So in the absence of none, I think this is largely because this is a module that we are all familiar with.
So, okay. Sorry.
You're not able to stop?
No, I've stopped. Network of maintenance.
So we'll just go back to the agenda. Okay, so this is currently a question and answer sessions. Previous questions has been taken. I did not see any hand raised. I also do not see any questions in the chat box. So I believe that we are all comfortable with the two sessions that we had. So I want to thank everyone for actively participating in this training for day 2. So without wasting much time, I'll hand over to Mr. Yashi for the closing remarks. And for those having issues with the registration link, I think it's your network, because I actually tried opening the link from my end and it did open. So kindly refresh. I'm sure it will eventually open, just the network. Thank you. Mr. Yashi, over to you, sir.
So thank you, Vivian. Thank you, Stephen, Shegun, and thank you, colleagues across the board. I think it has been so engaging. I'm happy. I am a user of SORMAS, but I discovered that it's becoming easier, better by day, based on the presentation that have been presented by colleagues. And this shows a sign of dedication, commitment to what we do. And you can all agree with me that indeed the optimization has indeed brought more light to areas that we can strengthen and do better, especially in the outbreak management module, where Stephen has dealt very well on that. And that has really been so interesting. And all the questions, I think Stephen did very well in attending to answer all the questions. We are still going to engage with the state to agree on who will be responsible for managing the outbreak management module on SORMAS. One of the key things that I will emphasize here is the issue of ownership. Somebody have to own the process. Somebody have to accept to say that it is my own. I know and aware of it, and I'm the one managing. So that, I think, at the end of this meeting, there will be another meeting after this training, where we will sit and carefully look at those things and see if there are ways we can make it better. I think everybody will be carried along. The essence of SORMAS is for us to be involved and take responsibility and even begin to manage our tasks based on what we are assigned. So it implies that the work is not one person work, it's all of our work. So we have to be sent to be doing something at a certain stage and ensure that we support the success of this system that we all believe in. So on behalf of my DG, Dr. Jide Idris, my director, Dr. Fatima Saleh, and my divisional lead, Dr. Muntari Hassan, and the acting HOD, Mr. Tajuddin Oro, who has been supporting in this process. I want to appreciate everybody and thank you for being a part of this success story. I will also appreciate the IEVN that has been behind this success all this time for what we are seeing now vis-a-vis other partners that are already on board to support and see how we can make it better. WHO, RTI, Resolve to Save Life, mention them, Task Force for Global Health, and many more that will be seen onboarding and see what they can support. So the good thing is that we'll have a system that is working. We will continue to strengthen it, and we need everybody attention. Thank you for taking your weekend to be part of this beautiful outing this morning. Till we see on Monday by the grace of God to conclude this part of 3 days training. So from my end, I say thank you and over. Bye.
Thank you, sir. Thank you, everyone.